Hi, my name is Bree. I'm a MSN student and I'm going to do a skills demonstration on how to administer an oral medication. So there are multiple steps. The first step is to verify that our medication order is correct. So I have here our patient's chart, and this is Seth. He's going to be our patient today. So the first thing we're going to do is verify the 6 rights of medication. So the right medication is ibuprofen, and that's what we have in our chart. Our right dose, which is 400 milligrams, which is also in our chart. Our right patient here, Mr. Lusignan, it's the right time, so it's 8:30. If it's for the right reason, so he has a headache and he rated it a 3 out of 10 earlier, which is why we got this order. And then we have the right route, so it's going to be an oral medication. Next, we're going to verify our patient. So, Mr. Lusignan, could you tell me your name and date of birth?
Seth Lusignan, 12/21/1997.
All right, so I'm going to double check that with the chart, 12/21/1997, Seth Lusignan, and I'm going to double check your band. Perfect. All right, so next I'm going to verify if you have any allergies. So according to your chart here, it says you have none. Is that correct?
That is correct. I do not have any.
Awesome. All right, so next we're going to educate our patient. So what we're going to do is we're going to talk about the ibuprofen. So the doctor ordered you ibuprofen because you were rating a 3 out of 10 headache. So ibuprofen is a non-steroidal anti-inflammatory. It treats pain, fevers, and inflammation. Another name for it's Advil. You might know it by Advil. So some of the side effects you might experience is upset stomach, nausea, and sometimes diarrhea. So if you have any of those, just please let me know and I can let the provider know. Another thing is I want you to take it with a full glass of water to minimize that GI upset. Do you drink alcohol?
I do not.
No? Beautiful. So we don't have to worry about that. And do you take any blood thinners?
I do not.
Perfect. All right. So at this point, I would perform hand hygiene. So the next thing we're going to do is we're going to assess your ability to swallow a medication. So I'm going to have you take a sip of water to make sure that you can get stuff down your throat without choking or having any difficulty. Do you feel like you got that down?
Yes, I do.
Perfect. So our patient can swallow an oral medication, which means we can get going. So next we're going to prep the med. So our MAR says that it's going to be a 400 milligram dose of ibuprofen. Here we have in 200 milligram tablets. So we have to do a little bit of med math and determine how many tablets we need to reach the 400 milligram dose. So 200 milligrams apiece, we're going to have 2 tablets. Next, we're going to pour that into a medication cup. Don't directly touch the medication with your hand, and if you do, use gloves. So we have 2 200 milligram tablets equaling 400 milligrams total. All right, so we're going to verify our patient one last time. We have Mr. Seth Lusignan here, date of birth 12/21/1997. So now I'm going to give you the medication, and I'm going to have you take it with the full glass of water. You don't have to drink all the water at once, but as much as you can. We're going to watch him swallow it to make sure he's able to get it down without issue. Do you feel like you have it down? No problem swallowing?
Nope.
Perfect. All right, so now we can document in our medical record appropriately saying that he was able to take the medication, no difficulty. And now we have our post-medication administration. So we're going to come back in 30 minutes and see how your pain's doing. If you start having any of those side effects, please let me know. And in 30 minutes, if it's not working, we can contact the provider for any additional medication needs. Do you have any questions for me?
I do not.
All right. And that is how you administer an oral medication.